There are risk factors for heart disease that we all think of on a daily basis, and those apply to both male and females. But there are certain risk factors that are unique just to the women. So things that happen during pregnancy, such as gestational diabetes, preeclampsia, gestational hypertension, those play a huge role in your cardiovascular health downstream. When you're in the thick of it, you're going to think of it more, right? So when you're pregnant and you're seeing your blood pressure being high, your OB is going to talk to you, you're going to worry about it at that time. But once you deliver, if things come back to normal, you're more likely to forget that that ever happened. And I encourage people not to do that. I encourage you to kind of put that down in a diary or something. It's going to be there in your medical chart, but you may not be following with your obstetrician for primary care down the road. So it's going to be something that you're going to have to be proactive about. I encourage people that if they've had any issues with, even if it's just borderline, nothing that you needed medicated, but just pay attention to it as you get older. Mention it at your primary care visits. If something else props up and you end up seeing a cardiologist, of course it's important to mention it again there as well. So diabetes is a risk factor that we've known about for a long time for both men and women. The thing about women is it affects their cardiovascular health more often than in men. And it also seems to affect their cardiovascular health in slightly different ways. So you think of cardiovascular disease as obstructive coronary artery disease in most cases. Women can have myocardial infarction without obstructive coronary disease. So there's an entity which we now call as MINOCA, and that can occur without having a 70 or 80% blockage. You can have just a 30% blockage and still have that event. Diabetes also in other ways stiffens up your heart, so it impairs the relaxation of the heart muscle. And so women will oftentimes have heart failure preserved ejection fraction, meaning that their pumping power of the heart is still normal on echocardiograms, but they present with the heart failure symptoms, shortness of breath and things like that. Women in general have very nonspecific symptoms. Sometimes as little as just nausea or indigestion can indicate a heart attack. And then combine that with being a diabetic, your symptoms may be completely masked. You might be more likely to have silent heart attacks. If I were to point out a particular age, I would think that the menopausal age is the most indicative of when your cardiovascular risk status increases, and partly driven by the hormonal changes. You know, estrogens are protective in ways by affecting your LDL, lowering your cholesterol, and keeping a high HDL. Once you attain menopause, their good cholesterol, or the HDL, declines. That estrogen protective effect is gone. A lot of times your metabolism in general tends to slow down. Some people say after the age of 40 it's harder to keep the weight off, and we all know healthy BMI is a good protective thing for cardiovascular events. Dealing with stress is hard, especially trying to multitask and doing a lot of things that the women superheroes are doing these days. It's especially challenging, but you do need to recognize signs of depression. If you're starting to feel overwhelmed, or if things that you used to do before that were pleasurable, you don't have any interest in doing those, that's a sign that perhaps the stress is overwhelming you and you're going on the depression side. Now, stress can affect people and make them anxious too, and either way, it affects your blood pressure, it affects your heart rate. So if there are things that, you know, are making you feel overwhelmed, do seek out ways to reduce your stress. Mindfulness, exercise, meditation, those are all ways that you can try, but there's no harm in seeking medication help if those things aren't working. So I think when you're talking about a healthy heart prescription, you want to look at what you're putting in your body. So you want to look at your nutrition. You want to make sure you're eating a lot of fresh fruits, vegetables, avoiding processed foods. And when I say processed foods, it's a big spectrum. So you want to stay away from prepackaged foods that are loaded in salt, added sugars. Beverages are included in that. You really want to be mindful of what you're putting in your body. You want to do low-fat skim dairy or cheeses like that. You also want to pay attention to exercise. So trying to exercise a moderate intensity, at least 150 minutes in a week. Now you may split it up depending on which day you have a little more time or what. It doesn't matter as long as you're getting it in. And you also want to build in some resistance training because you want to keep your muscle groups strong, and that tends to help your core. And that keeps your metabolism up by doing that. So the other thing is sleep, right? Sleep is important for your body because that's when your body rests, relaxes, and heals. So you do want to try to get your 6 to 8 hours of sleep every night. That will help your brain wake up in a calm state in the morning and kind of help you through the day by avoiding raising your heart rate too much. Traditionally, we think of heart disease as presenting as chest pain, chest pressure. Women need not have that. Sometimes it's something as simple as just feeling lightheaded. A lot of women say, oh, it's maybe I didn't drink enough water. But it may not be just that. So those could be signs that there are problems with your heart that you should get checked out. You could just feel maybe a fluttering in your chest, and it may turn out to be nothing, but it's better to get it checked out.